So I'm back with another video. I'm going to go over some stuff that I put into his food and also medications and stuff that he needs because he is an older dog. He is 15 years old. And actually today I have to rush him to the vet because of his stomach with what he's been sick with. So first things first, I started using Dynovate back in probably 2015, 2016, and it's supposed to help with his skin, but unfortunately it didn't. So when I took him to the vet, they said that he has severe allergies, which could be from like chicken, turkey, stuff like that, but they recommended a different diet, cut out all grain, flour, and soy. Wheat, grain, and soy are not good for dogs at all. If you have a dog with sensitivity issues like I do, it's not going to go well. This is metronidazole, or however the hell you say it, is the antibiotic they gave me when I took him to the vet the last time for a gastritis attack. And this is his Apoquel, which is his allergy pill. But for a while he stopped taking it, so I came to the conclusion just to get him the allergy injections, which for some dogs it could last a month, and other dogs it could last a little bit longer. Like with him, it lasted probably about a month and a half to 2 months. He hasn't actually had another allergy injection at all since the first couple, but he is going to get another one at some point. But before I made the switch to the injection, I started using Mixlab for pet medications, which is straight out of New York, and you can actually make customized medications, especially his allergy tablets. Like I was doing like cheesecake flavored mixed with chicken, all types of stuff for him. Another thing that I have to use is this bottle of eye ointment, because he has a little cyst on his eyelid, and sometimes it looks like it starts to go away, but it doesn't, and he likes to bust it open. He was getting chronic ear infections for a while, so I decided to go on Amazon and I looked up these wipes, which is cucumber aloe scented, and they work lovely. One of the last times I took him to the vet, I said just double check his ears because I want to make sure that there's nothing wrong. And they said his ears were 100% fantastic, looked a lot better than what they had been, because one of the last times he went to the vet for an ear infection, he actually had a double ear infection, but his one ear was completely swollen and filled with fluid. A lot of the time, he would not allow me to put drops in his ears or anything. I ended up actually having the vet do it, and they put the medication in his ears with no problem. Then they told me he had to come back in a week or so for another dose to just clear it up. I brought him right back. He saw the tech. He was in and out within like 5-10 minutes. This is for his arthritis, hip and joint, which I also found on Amazon for a reasonable price. But since he is stubborn with taking pills, I went to the smoke shop and picked up this bottle of CBD oil for him. He gets about 2 to 3 drops mixed in his food, but right now because of his stomach I cannot do that. This is an antifungal wipe because of his skin issues, because before I started his allergy medication, he was always laying on his back, scratching his stomach with his bottom paws. He would bite his back leg a lot and use his back leg to scratch right behind his shoulder, and it was a lot of dry blood. There was a nasty odor, and I spoke to the vet and she recommended that just in case it happened again, I can use the antifungal just to wipe him down if it was a fungal infection, just to prevent it. I used Glandex for him. a couple of times because he was wiping his ass across my carpet. This is his heart support medication, which the one time I took him to the vet, they said that he potentially could have a heart murmur, but they can't tell on how big or how serious it is. Otherwise, I spend the $600 for a EKG, but I have to do it when the cardiologist is there. His Tri-Heart and his Empirica. And the reason why I'm on top of his medications and giving him everything that he needs is because he, one, is an older dog. He's 15 years old. When I got him, he was 8. But one of the main reasons why I'm really on top of and I don't play with his health is because he has, like I've said before, skin issues. So I'm taking all prevention against everything, fleas, ticks, his allergies. I'm not playing with it because of how bad he gets. And they said that he is also allergic to fleas and ticks. When I got him, he was infested with fleas. It took me probably 2 weeks just to get the fleas off of him. He's a rescue dog. I had to sit here and freaking spray everything down. I'm losing my mind because he's my baby, and I'm just like, what the fuck do I do? So I took him to the first vet appointment. They gave me everything. Like, me and my ex-boyfriend went half on half. And the vet there, I did not like him one bit that they had, but there was other vets in the group that I go to, and they also have an emergency vet there. So the last time I did end up having to take him there to the emergency vet office because of his stomach, and it was too serious to the point where I couldn't even make an appointment. He was throwing up so bad, he was lethargic, all he wanted to do was sleep, he was severely dehydrated. I went to go take a shower, and he wound up having diarrhea on the bathroom floor, and he was bleeding. And that's why I was like, no, I'm taking him straight to the vet, and that was it.